Mm. I'm here again with Natalie Gedeker, a nurse practitioner from Washington University in St. Louis, and we'd like to invite Melissa Gibbons, a genetic counselor from University of Colorado in Denver, to join us to talk about the impact of early diagnosis in Duchenne muscular dystrophy. Melissa, maybe you can start off and discuss the role of genetic counselors in the diagnosis of Duchenne muscular dystrophy.
The genetic counselor's main role is really to ensure that the right test is sent. There's lots of different options out there and lots of different labs, and genetic counselors can ensure that the right test is sent for that individual. And then the second part that I think that genetic counselors are really
Yeah.
skilled at is the family education. So making sure we're presenting the genes at a level that is understandable for the family, and that's become more crucial over the years as we've had more genetic based therapies available. That understanding of the underlying genetic cause seems to be really important for these families to help them understand treatment options, and also the family education for what other family members may need to have testing based on this individual's.
Dr. Kuntz, can you speak to a little bit about how early diagnosis may lead to better outcomes for children with Duchenne muscular dystrophy?
A topic I care about a lot. Um, yes, I think that early intervention and management does make a difference in the long-term outcomes. It not only helps the family understand the situation and kind of prepare themselves and the child, um, but some simple things like initiating stretching and maintaining good range of motion, as well as good nutrition and appropriate weight for height, and just basic nutrition and issues like that is very important in the outcome for children with Duchenne muscular dystrophy. In addition, we know from some anatomic studies that the peak of the inflammatory response of the body to leakage of the internal muscle contents, meaning the CK that is so high in the blood comes from within the cells, and, as well as calcium within the cells. And when the muscular dystrophy progresses or exists over time, even before there are clinical symptoms, that leakage of intracellular contents leads to inflammation that creates secondary breakdown of the muscle fibers and muscle tissue. The peak of that inflammation is at 18 months of age, well before most children are diagnosed clinically. Um, and as that inflammation roils and continues with a life of its own, it creates tissue breakdown. When you look at the biopsies that were done many decades ago for diagnosis, you can see that at the time of diagnosis, there's already a significant amount of tissue loss. Now, if tissues are injured a little bit, that can be recovered from. But when tissues are damaged to the point of irreversible destruction, as can happen before clinical diagnosis in Duchenne, that tissue is lost and cannot be recovered. So early diagnosis can definitely lead to institution of measures that can preserve tissue. And that's one of the very, very most important parts of all of this. Because of the changes seen on muscle biopsy that I mentioned, meaning the inflammation, there were trials decades ago in the 1980s just using corticosteroids to see how this would impact the progress or the change in the function over time. And it's been very clear that institution of corticosteroid treatment leads to improved functional outcomes, delayed loss of ambulation, delayed loss of function. And there are other treatments now that are available beyond just the supportive physical therapy and corticosteroid therapies that can be instituted if the diagnosis is made early, particularly if it's made early with a precise mutation identified. There have been a number of clinical trials that have been done, including one that I participated in with children, with boys with Duchenne under 30 months of age, which showed that pulse oral therapy, so instead of daily steroids, just 2 days per week, so that the side effects were very minimum, that those children had normal trajectory of linear growth, and very few side effects. Those individual boys with Duchenne who were started early on that therapy had improved outcomes by the time they were 3, when their Bayley developmental scales, including their gross motor scales, were performed. So that type of study is being repeated with 1 day per week corticosteroid, and there are some other anti-inflammatory or tissue supportive, preserving kind of chemistry drugs that are being considered for future trials that could certainly be started very early in life and preserve tissue, which is the important thing here. The difficulty with starting these therapies early is that 30% of families don't have a family history. With dystrophin being such a large and complex gene, spontaneous mutation rates are high, and at least 30% of the children are not known to have a family history of Duchenne. So in those cases, in particular, we have to wait for clinical recognition of the disease, and as we've discussed, that does not tend to occur until the disease is advanced on muscle biopsy at 4 to 6 years of age, and sometimes even later. So because of all these, the potential benefit of intervening early and the difficulties of diagnosing the boys clinically or being suspicious because of family history not always being there, there is a movement in the country to begin adding dystrophinopathies to the newborn screening that's performed on all newborns across the United States. There are several states that have done pilots and now gone on to have legislation so that on a state-by-state basis, this is being done. I think there are 2 states now that have initiated this. I know in our own state this is under consideration in our state legislature, and PPMD is taking it to the federal committees within the Department of Health and Human Services for consideration of adding it to the national recommendation, the Uniform Screening Panel, or the RUSP. And I'm personally very hopeful that that will have traction and move forward.
Thank you, Dr. Kuntz. That was a great summary on why it's so important for us to get these boys diagnosed as early as we can.